Nursing NCLEX RN review video, what to expect on the NCLEX exam in 2021. In this video, I'm going to be talking about what to expect on the exam. Visit my website www.simplefitnurse.com for more NCLEX content review and a free ebook where I shared my study schedule for passing the NCLEX exam. Stay tuned until the end of this video and I'll show you how to do that. The NCLEX, as mentioned, is a test that you have never taken before. In school, you take a test that is difficult, but the difficulty doesn't increase as you answer more and more questions right. This exam, however, will get more difficult as you get questions right. Here is how I believe one should study to pass this exam, and how the exam becomes more challenging. It is basically split into what I call foundational knowledge and critical thinking skills. I talked about this in my previous video, but I'll go a little further in depth about what I mean here. There is foundational knowledge for nursing that you simply have to know. This means content review via a textbook or online resources is absolutely mandatory. You need to read areas that you are weaker in and improve your knowledge about all subjects of nursing. For example, you have to know what are the stages of labor, how to read fetal heart tracings, what are different cardiac drugs and rhythms, and know all the signs and symptoms of different mental health disorders. You basically have to remember foundational nursing content and major topics from each section of nursing. The way you're able to build on this knowledge is by reading a textbook as mentioned and to complete practice questions until you have a high level of understanding in peds, maternity, cardiac, or gastrointestinal, etc. To assess your level of understanding, you need to do practice questions. There are many resources online that offer practice questions from nursing.com, UWorld, NurseAchieve, and Hearst. When I took the NCLEX, I used UWorld to test my foundational nursing knowledge. Once I was able to obtain a score of greater than 60% on all the sections, that is when I knew I had obtained enough knowledge to go on to practicing my critical thinking skills. Before I get into how the NCLEX tests your critical thinking skills, I would appreciate it if you would rate this video either a thumbs up or a thumbs down. This helps me decide if these videos are helpful to people or if I'm just wasting my time. Thanks. As you know by now, the NCLEX tests your critical thinking skills. However, that is after the exam identifies you have enough foundational nursing knowledge for them to assess it. Critical thinking questions will show through the likes of select all that apply and prioritization questions. For example, they'll ask you which of these patient situations would you want to see first? A, an acutely ill pregnant woman, B, an oncology patient, or C, a person who suffered a recent trauma. The more complex questions will even give you a list of vital signs or abnormal lab values associated with the clinical situation and ask you to identify which patient is more sick and requires more immediate medical treatment. That is why you need to have enough foundational knowledge to eliminate certain answers and be able to differentiate between which patient is least a priority and which one is the most a priority to see first. In essence, this exam will continue to get more difficult until you reach the threshold for passing. To be above the threshold for passing, you need to have a very strong foundational nursing knowledge content. You need to have strong foundational nursing content in order for them to move on to more challenging questions which require those critical thinking questions. To pass, you have to be able to answer all these critical thinking questions correctly in order for you to be above that threshold. That is why it is so important for you to review content and do practice questions all the time. Which products test your critical thinking skills? The products on the internet that focus on testing your critical thinking skills are NurseAchieve and Nurse.com. For Nursing.com, you need to create a test and put the difficulty to level 3. For NurseAchieve, the test difficulty is very similar to that of the NCLEX. UWorld, despite popular opinion, is easier and should be used as a marker of how well you understand foundational nursing content. I've created a video talking about various NCLEX resources, and so if you're thinking about purchasing one of those, be sure to check that video out. It'll be right here. I have zero partnerships, by the way, to any of these companies or any of these organizations, and they're based on my honest opinion with no political agenda behind them. Thank you for watching this video until the end. In the next video, we will talk about strategies for test taking for the NCLEX exam. Be sure to leave a like if you found it helpful, and make sure you subscribe for more weekly nursing content. Thank you so much and have a nice day.
Hey guys, just thought I would show you how to get to my website. All you got to do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.